Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain-body connection and learn how to optimize your health. Today we're joined by Dr. Buddy Touchinsky, founder and CEO of Peak Integrative Medicine, a chiropractor and functional medicine practitioner. Dr. Touchinsky saw the gaps in traditional healthcare and built a team of medical doctors, nurse practitioners, chiropractors, and health coaches. Together, they take an innovative, integrative approach, combining functional medicine, lifestyle intervention, and advanced therapies to address root causes and help patients optimize their health. In today's episode, we are talking about the role of leaky gut as a contributing factor to a foggy mind, and we are going to discuss connecting the dots with testing and treatment that can be done to improve your gut health and ultimately your brain health. Enjoy. Dr. Buddy Touchinsky, welcome to the show.
Great to be here. Always nice to chat with you, and excited about today's topic.
Yeah, I'm excited to talk about it as well. So we are going to be talking about really all things gut health, from issues people may be having to testing and everything else. But first, before we do that, with you being licensed as a chiropractor initially, what kind of led you from, hey, adjusting's kind of my focus to, you know what, maybe we should pay attention to more than just that?
Yeah, so I came out of school. I was a back pain patient myself in high school, and that's how I got into the chiropractic. And I got out of chiropractic college, just focused on neck pain, back pain, sports injuries, things like that. And I quickly realized that often that was the least of people's worries. So they're coming in for back pain or chronic pain, joint pain, and it's because they were just in overall poor condition, poor health. And then I came across a book called Integrative Orthopedics, Alex Vasquez, and it blew my mind. And in there, he talked a lot about gut health and digestion and anti-inflammatory diets. And as I say, the rest was history. I just kept on building from there and learning from there. And here I am today. And it's one of probably my primary focuses as a practitioner in our practice. I'm the gut guy. So, and of course, we got and branched out into all sorts of chronic illness and disease and health optimization and all sorts of other things.
Yep. And it seems, that's something that happens a lot. You've got those who stay just regular chiropractic, and then you've got those who are like, man, there's so much more to the story. While they may be coming in for those acute issues, they've got a laundry list of other things that are along for the ride that you really need a bigger toolkit and arsenal to help people with.
Yeah. And no one else was addressing it. So that was the other thing. It's like, okay, who can I refer to help these people? And I'm in a fairly rural area, but it's probably no different anywhere else. And it's a little better these days now that it's gaining more traction with social media and everyone talking about health and wellness. But yeah, at the time, there's literally no one to send them to. So it's like, okay, I guess if not me, or I guess I'm the man for the job, and I'll go back in and dive deep and learn what I need to learn and start helping people. And that's what's been happening.
Correct. Because the terms leaky gut and intestinal permeability has really only been embraced the past few years in traditional medicine. They're now starting to talk about it more in like some of the continuing education I'll do for like depression and all that. But in the functional medicine space, it's not a new term. It's stuff that, we've been doing for well over a decade. So I'm first going to let you, talk about what leaky gut is, as well as intestinal permeability. Are they the same thing? Because some people are like, well, it's one or the other, because medically, it was really more about intestinal permeability before they really valued the other side.
Right. Yeah. So leaky gut syndrome, I tend to think that's more like the layperson's term for it. It's an easy way to visualize what's happening. Is the gut really leaking things? If you talk to a gastroenterologist or a microbiologist, especially going back 10, 15, 20 years, they almost kind of mock that description. But really what it's describing, in my opinion, is that increased intestinal permeability. Now, think about it. When we eat something, we swallow it, we chew it, we swallow it, goes in our stomach, and then eventually into our small intestine and large intestine. And as it's going through our intestines, we need to extract our nutrients out of that. And our nutrients need to get in the bloodstream somehow. And it does that by going through the gut wall. But it does so selectively, because we don't want large fragments of food or proteins or bacteria or other things that shouldn't get through that gut wall. And it's like a filter in a way, or the analogy I use, it's kind of like a screen in the window. So it's a nice day out, and it's I want to get some fresh air in here, but I don't want the mosquitoes in here. I don't want house flies. I don't want gnats in here. So I open the window, screen lets the air in, fresh air in, but keeps the other stuff out. So you can kind of think of the gut being like that. However, due to a variety of things, which we can dive into if you'd like, those holes in the screen, it's like taking a screwdriver and now jabbing big holes through it. So now you're not only letting fresh air in, you're letting the bugs in as well. So in terms of the gut, now you're letting protein fragments, stuff from our food in there, bacteria, bacterial byproducts, like something called LPS, for instance. And then now we start to have other problems because of that.
Yep. Yeah, absolutely. Correct. And I think it's important that we reference, yeah, as you said, it is selective things should be getting through into the circulation, not all these other things that are ultimately getting through, and that's creating a lot of issues. And before we really dive into it a lot more, let's just step back. Do you have to have digestive issues, constipation, diarrhea, heartburn, bloating to have a leaky gut?
Often people will, but sometimes people do not. And I think of a case I had early on. It was a 48-year-old gentleman who owned his own business, and he was having issues with sleep. He had low testosterone. He was having joint and muscle pain, weight gain, and he swore up and down, no, I don't have any gut problems. And when we ran some of the testing that we did back then, it showed major dysbiosis, so major bacterial overgrowth. I think he had a parasite, Giardia, if I'm not mistaken. It's going back about 8-10 years ago now. And lots of inflammation, is calprotectin. It wasn't in IBD zone of like 300, 400, 500 plus, but it was over 100. So it shows that his gut was fairly inflamed. And I think that was leading to a lot of the issues that he was complaining of at the time. But he's like, no, I have an iron stomach. I do fine. I feel fine. So he said he denied having any gut problems at the time, was kind of questioning, well, why are we doing this gut test? But good thing we did.
Correct. Yeah. Because while many people will have gut issues, I often tell people, look, man, if you've got joint issues, if you've got skin issues, acne, and you don't have rheumatoid arthritis, there's no severe degeneration upon imaging. It's like, the foods you're eating and the health of your gut plays a massive role in that, because it does extend beyond just those digestive issues that many people have. And I do want to quickly, dysbiosis, for those that have never heard the term, it basically is you get an imbalance in bacteria. You get bacteria where they shouldn't be, or they get to excessive populations beyond what it should be. So if you think about like a city or a state, right, there's healthy populations. You don't want everyone to be an attorney. You don't want everyone to do one job. So you make up the right ecosystem, and that ultimately gives us the byproducts and the health that we would like to have.
I'll give you another analogy that I really like. It's like having a garden. You only got so much space in there, and you want to make a salad. So you want tomatoes, you want cucumbers, you want bell peppers. But if you like one season that happened to me is I must have got a lot of tomato seed drop on the ground from the season before, and it was overrun with tomatoes. Well, even though tomatoes are good, you want more than tomatoes. So same thing with our healthy gut microbiome. We want a variety of different bacteria because they all have their own unique function that helps the body.
Yep. And so what are, now that we've kind of introduced dysbiosis and that whole side and leaky gut, what are 5 things that contribute to leaky gut that we routinely see with individuals?
Got it. So I would say stress is probably one of the major contributors. And in fact, there's research showing that professional athletes tend to have a higher incidence of gut issues. And it's because they're always training hard. They're always in the spotlight. Sometimes they're probably overtraining, and there's just a lot of stress placed upon them. So stress, and then there's probably some mechanisms there through cortisol, can disrupt the microbiome and then lead to a breakdown of those gut walls.
Okay.
Number 2 would be the wrong diet. So lots of processed foods, a heavy emphasis on especially processed grains, excessive sugars. That changes the makeup of the microbiome, and that can lead to a breakdown of that gut wall, leading to leaky gut syndrome. Another one may be some sort of infections. You get exposed to something. So it could be through foodborne illness. It could be just something that you are ingest, because no matter how much we clean or cook our foods, there's always going to be some sort of contamination on there, a little bit, some microbes, whether that's bacteria, viruses, yeast, or parasites. So that can disrupt it. Or sometimes mold and mycotoxins can cause a breakdown of that gut wall, leading to leaky gut syndrome.
Okay.
So help me out here. What are two more to round out the five? Or what do you got?
Yeah, well, we'll add some more in. Let's quickly do, right? So you mentioned grains. So a lot of people were like, oh, but we've ate grains for like as long as basically civilization has been around. So why are grains starting to be an issue now, or at least in the recent past, compared to, thousands, millions, however long people think people have existed? If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying.
Part of it is, and I've had people share this with me, that they can go over to Italy, for instance, and have pasta and bread and do just fine. But here in the States, they eat the same foods, or seemingly the same foods, and they have problems with gut pain, gut problems. Two theories there. One is that they tend to use more yeast and let the flours ferment a little bit more when they're making something like a sourdough bread, for instance. So you're not getting necessarily like a raw bread product or a raw grain product. Like here, I'm told they'll take like these bread molds and inject them with air and puff them up that way, so they're not yeast risen. And so that could cause the gluten, which is the chewy part that makes bread chewy and kind of hold together. And often what causes gut issues isn't digested or fermented or broken down quite as much. And the second theory is what we use on our crops here. So glyphosate is used a lot more here than overseas. And some people will make the argument that it's not really a grain or a gluten issue that we have. It's more of a glyphosate issue, or commonly known as, it's the main ingredient in Roundup.
Yep. And we can actually just put that down as number 4. It's the chemicals that are being sprayed on foods and some of the stuff, even in the processing of foods, beyond just ultra processed foods, but just kind of the whole growing process alone has a lot of things that can contribute to leaky gut. And then number 5, I even just go on the medication side. There's a lot of medications that, with starting chiropractic, right? You had a lot of patients who did ibuprofen, they did other things, and that's known to impact the lining of the gut. But then you've got those who do have heartburn. And so they are doing Nexium or Prilosec. They're doing all those acid blockers. But when you do that, you also disrupt the gut microbiome. You impact your ability to produce and really activate your digestive enzymes. Because what people don't realize is that stomach is supposed to be insanely acidic, and it's like a furnace. Like stuff gets in there, it should be burnt up. And you, with the right acidity, that's where you actually activate and release digestive enzymes. You're able to do things with like B12 and all that. And if it's not appropriate, that gives people issues. So we can make that number 5, but we could make the list keep going. But I think that's probably good.
Yeah, not to mention antibiotics as well. And I think, what do they say? One course of amoxicillin, which is pretty plain Jane antibiotic that everyone gets when they get a sore throat or something like that, a minor infection, can disrupt the microbiome for up to 2 years. And I've seen some microbiologists say it never goes back to the way it was before that course of antibiotics. So imagine if you're put on a Z-Pack every time you get sick, and it's multiple times throughout the year. And we see this with young kids all the time, where I think the most extreme case of this was a 2-year-old that had been on like 10 to 12 courses of antibiotics, tubes in the ears, adenoids removed, still getting infections every other month, it seemed. And completely wiped out their microbiome.
Yep. And that stuff we see all the time. Like you said, we see it in kids with ear infections. People are like, oh, my kid's got it. It's like, please stop running for the antibiotics, because there are those doctors who will put your kid on it time and time again. And ultimately, a developing immune system's a fragile immune system, and you can really set a bad path forward.
Yeah.
And that leads to that dysbiosis and the inflammation. Briefly though, you mentioned LPS earlier, so that stands for lipopolysaccharide. Do you care to spend about a minute discussing what it is and how lipopolysaccharide and maybe other byproducts or metabolites from bacteria production in the gut can negatively impact beyond just the gut?
Yeah, so LPS, lipopolysaccharide, is a bacterial byproduct that comes from, I believe it's formed mainly from when we eat saturated fats in our diet. So that's why I sometimes question people that go on carnivore prematurely without trying some other things first, because if they have leaky gut syndrome and then they add a lot of saturated fat on top, it could cause problems. But even in the context of the average person following the average diet, if you have a lot of LPS or other bacterial byproducts that are forming and they get in through that gut wall, so now they're getting into the bloodstream. And there's something that's in the bloodstream that shouldn't be there. So anytime that happens, so you can think about getting a puncture wound or a cut and you get some bacteria or some dirt in there, what's going to happen is your body has to deal with that. It sees it as a foreign invader, it shouldn't be there. So it starts to have the immune system spring into action. So now you got these white blood cells that are released to the area, there's platelets, there's a lot of different reactions that happen at that level. And if it happens on occasion, like when you do get a cut or when you get an injury, or maybe you do get some bacteria into your body that's going to be there and you need that immune system to fight it. All right, no big deal. That's supposed to happen. However, when that's happening with every single meal and every single snack that you eat, now you're getting this more consistent immune response. So inevitably there seems to be some friendly fire there, and you can develop auto antibodies. So then those things can affect pretty much anything in the body. And I've had people with all sorts of issues, from Hashimoto's thyroiditis to brain fog to tremors to joint muscle pain, like you see with rheumatoid arthritis, for instance, fibromyalgia. I mean, you name it, it can affect different. It depends on what tissues it affects, and it's different for everyone. But you get that response because you're constantly getting exposed to that through that leaky gut mechanism, and then it just in general can cause just systemic inflammation, because the immune response, especially that early immune response that's non-specific, is that's what inflammation is, and that can affect you anywhere, especially if you have like your problem areas, like if you already have a little bit of joint damage and cartilage damage, like say in your thumb, and this is happening because of your leaky gut. Well, you're going to be more likely to have pain in that thumb.
Yep, and this really kind of falls underneath that category that the research is starting to more acknowledge. It's that chronic low-grade inflammation and chronic low-grade infections. For so long, people were like, man, I don't have an infection. If I did, I'd know it. I'd be running a fever and everything else. But we do see those chronic low-grade infections where people don't run fevers, or that chronic low-grade inflammation where it does damage over time. And, we're going to dive into the world of the brain pretty soon. But, when we look at the models of depression in animals, they're routinely using lipopolysaccharide because it is a inflammatory thing, right? So they're injecting the animals with it. And it's important, as you noted, right? It gets into systemic circulation and it impacts the brain. So let's kind of dive into there about how changes in the gut microbiome impact the brain. So let's maybe first start with, what does a good gut look like? What are maybe some of the good metabolites that should be produced? And then we can transition to when the gut microbiome gets distorted, and then kind of go down that lipopolysaccharide a little bit more.
Yeah. So what happens when things are going right, or what it should look like, is we eat all of the right foods. So by that, I mean plenty of plant materials. I would say lean proteins are part of that, getting plenty of protein, but that goes into the gut, and then it feeds the good gut bacteria that should be there. So that's what's floating around. I look at it in 3 layers. So you have what's happening in the center. So that's the water going through the hose. That's your food. And then amongst that, along the side walls, would be our healthy bacteria that live there. And there's healthy yeast as well. But when we're eating the right foods, those organisms, those healthy gut microbes are happy and healthy when they're eating and digesting and fermenting fibers from all those foods that we should be eating. And then that produces something called short chain fatty acids. There's polyphenols, there's other compounds that keep the gut healthy, keep the gut walls healthy. And there's something called the mucosa layer that protects the gut wall. So the analogy I use for that, it's kind of like wearing a long sleeve shirt as you're walking through the woods. It's protecting your skin. So that mucosa layer is there. It protects the skin of the gut. And just like walking through the woods, if you brush up against some poison ivy and you're wearing that long sleeve, it doesn't interact with the skin, doesn't cause any irritation, doesn't cause any of the reactions that we get when we get like a poison ivy infection. And then that starts to spread and get itchy and irritated. But if you have a breakdown of that mucosa layer because of a lot of the things we talked about before, whether it's stress, poor diet, medications, etc., well, now you get a breakdown of mucosal wall. So now as you walk through the woods, now that poison ivy is rubbing up against the skin. In this case, the skin in the gut is interacting with our foods and microbes, many not so desirable. So now you start to get a reaction there. And then ultimately you start to get a widening of the gaps between the cells of the cell wall. So instead of being that nice new screen, letting fresh air and keeping the bugs out, now you start getting stuff that goes into the bloodstream and then causing systemic effects.
Yep. And so, when we look at that with the brain, right? So we've talked about the good, we've talked about, because we know with the good, you digest everything, like you said, the metabolites, like butyrate helps the brain develop and all that stuff. But then on the bad side, what are some of the conditions or symptoms people may have from a leaky gut that goes on for a period of time with their brain? And we're not going to list them all because you could probably say everything, but what maybe 3 big ones that people may not really think about?
I'd say just that description, that person that says like, hey, I just feel like foggy all the time. I can't concentrate. I can't focus. And you try to do some work, you get sidetracked easily, get distracted easily. You just can't think straight. You start forgetting things. And if you don't know any better, a lot of people just associate it as, oh, I'm just getting old. Or maybe I'm just too stressed out. I got the kids, I got work, I got so much going on. I'm just overwhelmed. I mean, that might be part of it too. But especially with leaky gut and that low-grade brain inflammation, things just aren't going to fire correctly and you're not going to function correctly. So it goes all the way from there on one end of the spectrum, it's kind of mild stuff. I would say it's, in a lot of those cases, it's more than mild, but maybe a minor nuisance. You're still functional at that point, all the way through to the more extreme cases where people will start to get symptoms of maybe like more severe memory loss, almost like the same symptoms you get with traumatic brain injury or concussions. And then, on top of that, if you do have a traumatic brain injury or concussion, and this is certainly your area of expertise, that just ramps everything up and makes everything that much worse.
Correct. Yep. And, and even beyond that, we can go into basically any type of dementia and all of that, and you're seeing changes in the gut microbiome years or even decades sooner. And we'd probably be a little remiss if we didn't take a second, because the world of gut's been evolving and everything's been about the gut brain axis. And everyone's like, oh, well, the gut's like the second brain. But, I don't want to spend a ton of time on it, but, people may be disappointed if we don't. So the vagus nerve, let's briefly talk about the vagus nerve from kind of its influence from brain down and then back up.
Yeah, so we know from research now, we don't know all the connections or all the fine details of it, but we know it's almost like a two-way street where their gut and the organs. So the vagus nerve is called the wanderer, the great wanderer, because it innervates and goes through and can affect functions of various organs in our body. It's that comes from the brain, and it can affect things that way. But then we're also finding out that if there's any problems in those areas, like including what we're talking about today, the gut microbiome, it seems to feed signals back the other way to the brain. So it can work in both directions. And I know with brain injury, we often see things like slow gut motility. So it's common to see things like constipation. Then that could lead to something called SIBO if there's a brain injury. And we also know that it's common for people with gut issues, gut inflammation and other gut infections that can cause brain issues. Like we talked about having foggy brain fog and lack of focus and memory loss and things like that. And I'm sure you see that in your practice as well, where it's very common to have that really work both ways.
Yep. Yeah, absolutely. And it does, and there was research they've done where they basically resect the vagus nerve, they sever it in rats, and like, oh, wow, they didn't get Parkinson's. They didn't get certain types of degeneration because, as you said, things can basically ascend the vagus nerve and then impact the brain. And then on the other side, right, the brain fires down, digestive enzymes, stomach acid production, intestinal lining permeability. And that's where now you start seeing a lot of people in the natural health space are like, oh, let's do vagus nerve exercises. Been around forever. But, now more and more people are talking about it, but that's kind of a basic level of going after it. So we've talked a lot about dysbiosis, leaky gut, what happens when it's good, what happens when it's bad. Now we're going to go into the testing arena. And for those listening, and if you've already done stuff, this testing arena, it's tricky. It's frustrating. It's not perfect. And there's a lot out there. So, what we're going to be talking about is really just our opinions, kind of maybe some of the stuff we've tried in the past where we've evolved to, because I'm not using the same test now that I used a few years ago. I've shifted. So let's go into first stool testing from a gut health perspective.
Yeah, so there's different types of stool testing, different companies, different laboratories running different types of tests. In the functional medicine world, they're all kind of testing kind of the same stuff. But we should touch upon the conventional world first, because often I'll have people come to me and they'll say, oh, I had a stool test, everything was fine. But in that context, they're usually testing for I call it the big bad ugly stuff. So it's going to be things like food poisoning, foodborne illness, stomach flu type stuff. So it's the C. diffs, the E. coli's, and things like that. It's usually a panel of maybe 5 to 7, 8 tests, different organisms. Whereas on a functional medicine test, we expand that net quite a bit, and we look for all of those same organisms, plus an entirely different category of organisms. So they're not pathogenic like that first group I mentioned, meaning disease causing. So those cause obvious disease. If you ever had food poisoning or stomach flu, you got diarrhea, that's crazy. You got the chills, sweats, fever, vomiting, stomach cramps, stomach pains. But this other category is called opportunistic bacteria. So these are bacteria and other organisms, there's parasites and fungus and yeast, that can move in. They don't necessarily cause obvious disease. So you're not vomiting as soon as you get an overgrowth of these, but they live there. They fly underneath the radar of the immune system. They don't want a major response because they just want to live there and kind of chill out. But because of the byproducts they release, and because they're taking up space of other organisms that are supposed to do some good for us, they're either neutral, so they're not good or bad necessarily, other than taking up space from the good ones, or they can be slightly bad where they're releasing byproducts and compounds that can trigger autoimmunity, for instance, or just trigger general inflammation, which then can affect us body-wide. So that's one of the things that a lot of functional medicine, or most of functional medicine tests, will test for. We also look at the levels of major classes of beneficial bacteria. So if we see really low levels of that, we know, okay, we need to address that by either using probiotics or prebiotics or other compounds that help promote their growth. In addition to the whole variety of organisms, good and bad, that we can see in the gut, we also look for functional markers. So these are things like, are there any undigested fats in the stool? And if there are, then we look at, okay, are you eating too much? Are you eating too quickly and not chewing enough? Is your gallbladder not working and releasing enough bile? So we can make some adjustments there. Same thing with pancreatic elastase, which is an enzyme released by the pancreas that helps us digest food. So it's just one little glimpse into how is that all working. And there again, if it's on the low side and we need some help, we need some support, we can do that. Or we can use things like bitters to help stimulate digestion, making sure the person's not driving down the road doing 5,000 things at once and then also shoving a sandwich in their face and their body's not ready to digest that. And then we can have that conversation with the person. We can also look at levels of inflammation. There's something called calprotectin, which at high levels could indicate an autoimmune inflammatory bowel disease process, or at lower levels, but still elevated from what we want to see, can indicate just general intestinal inflammation. And then there's several others like the immune system of the gut. Secretory IgA is one. That's the troops that live in the gut and help us fight off infection at that level. And if they're really high, we know the gut's in high alert and trying to fight things off. Or it's the other side where it's really low and it's at the point where it's probably been there a long time, the problem, and it's spent, it's wore out, the troops are gone, so that we need to support that before we do anything else. So I really like the functional medicine test because it allows us to change things and focus on that individual and give them what they need most. And that's with any test. What you want it to do is, and the reason for doing it is, will it change your treatment plan? And with the gut test, it's one of those where it's like, yes, it absolutely changes what I will do based on the findings in those different categories of tests that I just mentioned.
Yep. And I really also like the breakdown of butyrate and the other short chain fatty acids to go in conjunction, because a lot of people have those low, and based upon the beneficial bacteria, you kind of get to be a lot more strategic, because, probiotics is just kind of this term that really means a whole lot of nothing, because there's so many different strains. And I really like the test that we both do, because you get a really good idea. You're like, oh, wow, I saw this. You have no butyrate, but you also have no Akkermansia, and Akkermansia is a big producer of butyrate. Or you've got these bifidobacterium or lactobacilli species are really low, and you can be a lot more targeted, and you can kind of go and find the probiotic that's best going to support their findings, versus saying, hey, let's just give you a super broad-based probiotic because we don't really know what we're dealing with. So we really get to be,
I have to say, or the prebiotic fibers to feed the proper bacteria, because like we mentioned earlier, even though many of these categories of bacteria are good, if you have way too much of some and not others, that can be a problem as well.
Correct. Yep. So, we've talked about, right, the things it shows. What are some of the weaknesses, though, with the stool testing? Because the stool testing by no means is perfect.
Yeah, so I guess one major thing we should address, so we can talk about some of the functional medicine limitations as well too of those particular tests. But I see a lot of these direct-to-consumer microbiome tests, and the ones that I've seen, it doesn't include a lot of the stuff we just talked about, but it includes the broad categories of probiotic bacteria. And then there might be some genetic markers in there as well. And then they spit out a report that basically gives you should eat more of these foods and stay away from those foods. And I just never found them very useful. Yeah, they're a little bit cheaper than some of the tests we use. So you might be able to get a direct consumer test for like $250, $300 instead of $400 or $500, like the ones that we use. But they're really not that useful. And most of the time I see they say eat more fruits and vegetables, which we all should be eating anyway. And so I don't find them very useful. In terms of the functional medicine testing, even some of them can get a little bit into the weeds with some of those different assessments where they're looking at the microbiome from a really zoomed out level. You're looking at great broad categories of bacterial types. And it lends itself to like trying to micromanage the microbiome, which it doesn't really work that way. You can't really say like, oh, we need more bifidobacteria, so I'm going to take this bifidobacteria probiotic, because we know from research that once you stop taking that particular probiotic, that strain's out of your gut probably within a month or so. Even some of the better probiotics that we use, like spore-based probiotics, they might last a little bit longer. But what makes the bigger change and the more persistent change is making those dietary changes to promote the growth of the bacteria that we want there. So, but yeah, with some of those tests, it seems like, okay, we're getting into that stuff and you take more of this, more of that. And that's not really how the microbiome works.
Yep. Yeah. And some of the, functional tests, there have been some validity issues. There have been some, test, retest. And then I'm always cautious on the ones that are partnering with certain supplement companies where they're basically trying to pre-tell you like, oh, here's what your results are, and then here's all the supplements you should then do for it. It's, while many providers like the protocols, personally, I'd always recommend avoiding those protocol providers. People need to be able to really dissect it on their own.
Yeah, you really need that clinical integration there. And I see this a lot, and I'll use some of these tests, and not even just stool tests. There's blood tests out there. There's other like expanded panels for blood work, and you'll go through these companies and they'll give you recommendations of what to take. And yeah, they're okay, but like even take something like iron, for example. That's a kind of a clear example. Is it might suggest that you're low in iron, but why are you low in iron? Is it because you're not eating enough, not absorbing enough? Maybe you're female and you're losing too much iron on a monthly basis. Maybe you have a stomach ulcer or tumor and it's bleeding all of the time. So those automatic algorithm-based test results and plans don't account for all of the different factors that affect people. So same thing, the microbiome tests, the stool tests aren't immune to that. And yeah, it might give the practitioner a start, but you don't want to go based on that alone. And certainly when it's direct to consumer, that's a lot of what you're missing. They're spitting out a bunch of information data based on algorithms, but there's lots of different variables there that you don't know if you don't know.
Yeah. All right. Anything else you want to cover on the stool testing before we move to the next one?
I think that's it. I was going to say they're not the most fun tests to do because you do them on your own. People ask all the time, "Am I going to come into your office and like, how do I give a stool sample?" But now put your fears at rest. Part of them. Some of them, you get a take-home kit. You go home and you provide the sample in the privacy of your own bathroom. But then part of that is you have to sample and get it and put it into a test tube. So not the most fun test, but it's one of those probably more than. I mean, blood labs are probably the most common tests that we use, but stool testing is probably the second most useful and the second most common test that we order because it does provide so much information for our cases.
Okay. All right, let's go into blood testing now from gut health, whether it's looking at intestinal barrier to even the whole food sensitivity arena.
Yeah. So I love the food sensitivity, food allergy, food intolerance, food inflammation, however you want to say that. Different tests will use different terminology. Some will include more than one of the above. So that's something, I don't know how you feel about this, to be quite honest, but in our practice, it's not one of our initial tests, unless someone has already gone through the ringer with another practitioner, perhaps. But it's not one of the first tests we order because if you have a lot of intestinal dysbiosis, leaky gut syndrome, inflammation, more stuff is going to get through the gut wall. So we talked about that before. So if you do a blood test, which checks for antibodies and other types of reactions to various food and food ingredients. So I think the one we use, it's like 287 food and food ingredients. So if you have a situation where more stuff is getting into the bloodstream, then obviously you're going to be reactive to more stuff. And then what we find is that if someone goes and has that test on their own or with another practitioner right at the beginning of their care and the beginning of their journey and trying to heal themselves, they'll light up the whole test. Now they're afraid to eat anything and they're anxious. They don't know what to eat. They get frustrated because they can only eat like 5 different foods. So in the beginning, we usually try to stay away from that. We work on the gut first through the usual stool testing, microbiome gut function test. We clean up their diet and then work on lifestyle and do that for a few months first. And then if they continue to have problems, so most people, if they do that first part, I would say 70% or more never need to go on and do a food allergy test or food intolerance test. But for those who continue to have issues and we're not quite sure, we can't identify it through diet elimination alone. All right, let's get the food allergy, food inflammation, food intolerance test and see what foods are continuing to light up their results, and then avoid those, which will help things continue to calm down and heal up better. So that's where I stand on the food allergy inflammation testing. I don't know how you feel about it, or because I know there's an argument to be made. You can do it right from the beginning too, because you'll be able to see which ones irritate the person the most to help them heal a little bit faster.
Yeah, I used to run them more frequently years ago, but over the past couple of years, honestly, I don't run a whole lot. I'm more of like, hey, go gluten-free, dairy-free. Let's see where you're at. Then let's rebuild your gut. And if we need to, then let's do it. But up front, like you said, right, you get someone and you run one of these specialized tests and they light it up 25, 50% of everything. And it's like, they're like, I don't even eat half those foods. How's that positive? And it's like, well, there's what's called cross-reactivity. So ultimately, I tell people this is like, you're at a place and you're like, I think that looks like so-and-so. And then when you get closer, you're like, nope, definitely not them. Well, the immune system does the same thing. It can attack things that it shouldn't be attacking because it's confused. And if you get the test and it lights up, it really just means your immune system is confused. It doesn't mean you actually have issues with all of those foods. So I've actually stopped doing it for the most part, for a couple different reasons, because in general, I don't really find it's a big needle mover for most of the people. And we've got to be careful when we're running these labs, because unfortunately, a lot of the tests that we are talking about, these are all self-pay, and so we've got to be, when we make these decisions, or at least I hope that providers do when they make these decisions, because I know we do, is we try to say, like, look, we're going to ask you to spend money on a test. We need something that's actionable, that really is going to move the needle in the highest leverage way possible. And then if we want to, then go to the next level with testing, right? And I do want to briefly let you explain the difference, because there's a lot of terms being used interchangeably. We'll group food allergy by itself, and then we'll group food sensitivity and food intolerance in their own group. So briefly explain the difference between the two, because a lot of patients, I know they come in probably to you and they're just using it completely as if they all mean the same thing. What does it actually mean?
Yeah, so food allergy, and there might even be like levels of this. So true food allergy, or an immediate onset allergy, an IgE, you might see that allergy response, an anaphylactic type of response. So that's like the peanut allergy, where you get exposed to even peanut dust, your tongue's blowing up, your airways are closing, and you need the EpiPen to straighten that out, all the way through to people that just break out in hives immediately after getting exposed to something. So when you're talking to especially a conventional allergist or a conventional medical doctor, and you say food allergy, that's what they're going to think. And that's why when I talk to some people, I'll say, oh, we can test you ultimately if we are still struggling after a few months. And I mentioned the fact that we can test for food intolerances, food allergies. I'll say, I already had that test done. I went to the allergist and they pricked my back with this grid, and they see what I reacted to. Well, that's that one type of allergic response, that allergy response. And then we have some delayed onset allergy. So this is like your IgG response. This is when you eat something tonight for dinner, you might not notice it until the middle of the next day, and you never associate the two together because it's not an immediate response. And then to the other side, where it's just a pure intolerance, perhaps. So you probably heard of things like dairy or lactose intolerance. So that's just where your body can't break down that lactose, and it gets down to the lower bowels and draws water, and it gives us diarrhea and cramping and all the associated side effects. We get lactose intolerance. So that's not an immune system response, but it's still creating a stress on the body and a problem on the body. So that's the main difference between those. And then there's just a general inflammatory response, where if you're eating foods like maybe fried foods using certain like oils, or you're eating too much sugar or processed grains, that can just trigger a general inflammatory response and irritate the gut. There, it's just a general irritation. It's not an allergic response. So that's the range of different reactions that we often see.
Okay. And then are you wanting to talk at all about some of the other blood tests, because there are blood tests for like lipopolysaccharides and some of those other markers of, not only systemic inflammation with LPS, but intestinal barrier breakdown. I don't personally run those tests a lot. I know some other clinics, they kind of live and die with that test as kind of one of their starting points.
Yeah, need to see. I mean, I'd probably run a lot more tests if money was no object or if it was free, but it's kind of like one of those things where you said before, pick your battles, and we have to be judicious with our patients' cash reserves. So order the tests that are going to give us the most impact and actually could potentially change how we address their case. With that said, there's some that are found on everyday ordinary blood work, even from the conventional family doctor, conventional doctors. That might be something like C-reactive protein, for instance, or ESR, which is sedimentation rates. There's even one called eosinophils, which could indicate some intestinal inflammation. So there are clues in other tests. And there again, that's where the clinical integration comes into play, where you have those sort of tests, you kind of suspect some things. And then if you go on and get like gut microbiome, gut function test, you have test results there. And it gets to the point where, all right, enough data. We know what we're working on. We know what we need to do. Let's go to work, versus do all these battery of tests. And I've seen people come in, they've had literally $4,000 to $5,000 worth of testing done, all sorts of inflammatory markers, all sorts of, white blood cell, different types of markers there. Maybe the cases that are really chronically severe, Lyme cases, chronic inflammatory syndrome, stuff like that. Maybe you want to get some of those tests, but for the average person, it becomes just be a lot of noise, and then it becomes overwhelming for the patient and the clinician alike. So yeah, the tests that we run, we stick with those. That gives us enough information, and we move on from there. And if something happens where we're not getting results, or we need to dive a little bit deeper, we can always go deeper. That's certainly available.
Yep. Yeah, I'm kind of in the same boat, because the stool testing is a lot more actionable for basically similar pricing. There's a lot more you can do with it. And like you said, it's clinical integration and taking some of the labs, because sometimes C-reactive protein, you need to go deeper because there's not obvious things. It's a non-specific marker, versus you're like, hey, you're insulin resistant and you're diabetic. Like, that's probably where we need to start, because that alone is going to shred your gut, change imbalances in your gut microbiome.
Yeah, absolutely.
Next, I don't personally do a lot of this testing, but I know lots of people come in having it done. So people are doing urinary testing for metabolites that, they're basically correlating, saying like, oh, well, this is going to be bacterial, or this is going to be yeast. Are you doing anything on that? And, this more of the organic acid testing that some people are just kind of in love with. They're going to have every single patient they see is going to do it. Whereas I'm kind of on the other end of the spectrum. If you come in, I'm never going to do it on you. And I'm probably not overly going to look at those results, because it just doesn't rank up there really high for me.
Yeah, when I first started functional medicine, I looked at that test and like, man, this is so awesome. It has so much information. And then you start looking at cases and getting the results back, and you're looking like through the interpretation manuals, you're looking up the different individual organic acids, and it just becomes so overwhelming. And at the end of the day, like you said, it really doesn't add a whole lot to the picture. Now, I can make an argument for some of the microbiome related metabolites. So some of them that can indicate that you have a bacterial overgrowth or yeast overgrowth. Sometimes the stool testing honestly misses some of that stuff. But usually you pick that up when you're doing the patient history and going through their symptoms. It kind of gives you an idea that they're dealing with that anyway. And there's enough clues elsewhere. And a lot of times what we're doing anyway, when we treat someone, it's going to address those things, whether we confirm they're there absolutely yes or not. So yeah, the urine testing, the organic acids, again, really cool to have, but is it worth $400 and $500? No, nowhere close to it. If I could do it for $50, maybe. And I'm sure, and again, now the caveat is some severe cases where you can't figure it out, or where you're not getting anywhere from the basic stuff, then I could see myself, and I've done that in the past, where it's like, all right, I don't know what to do with this patient. I'm honest with the patient, say, hey, I don't know where to go with this. There's this test that could possibly provide us some more information, and here's the cost. We make that decision together, but by no means is it a routine test. I can't remember the last time I ordered one. I'll put it that way.
Correct. It's been years for me, and just maybe I'm not smart enough, but it just was not something that I prioritized really high. And people would come in, often bring in multiple. And I'm just like, well, you're still not feeling any better. Like, it's, and that's important to realize, is in the natural health space, we do have to acknowledge that there are those in the natural health space who are absolutely guilty of over testing people. And, the companies push it, and people come in with way too many tests that don't really have a lot of clinical utility. And that is frustrating, because then patients, they kind of feel, because they've spent the money on it, that we should then be able to do something with it, when it's like, I'm sorry, but I don't actually put that up there in the hierarchy of things that I use in making my decisions. So, we've talked about testing. Let's start going a little bit into treatment considerations that people should do. So let's kind of almost start with what's just kind of the basic level, the foundational things that people should be doing to help leaky guts? Because we're really kind of, even the healthiest of people are still going in and out of leaky gut transiently due to changes in sleep or stress and other things like that. So what are just like, boom, these are the foundational things pretty much anyone should be doing for their gut health?
Yeah, and the answers will be it's something that I share quite often with my patients. And what I like about what we do is what helps one thing will help all the things. So everything I mentioned is going to help with leaky gut, but it's also going to help with diabetes potentially, or poor metabolism. It's going to help you lose weight. It's going to help your brain function better. It's going to help you sleep better, have less pain, and so on and so forth. Because what makes one type of area or one area of the body healthier is probably going to make the other areas of the body healthier as well. So it's the basic foundational things. It's getting enough sleep at night. So getting poor sleep, being chronically sleep deprived is going to cause a whole host of problems in the body. One ultimately affecting the gut and the microbiome. Eating the right foods. So that could mean different things for different people, depending on your sensitivities and intolerances. But in general, for the most part, that means eating plenty of vegetables of all types. More variety, the better. I tend to stick to lean proteins. That doesn't have to be lean all the time, but for the most part, you should probably stick to your lean proteins. And same thing, variety. So chicken, lots of fish is pretty good. Red meat on occasion, whatever you like there is going to be good. Or if you're vegetarian, you don't eat a whole lot of meat, there's certainly vegetarian sources of protein as well. Some fruits, I tend to stick to the berries. So blueberries, strawberries, blackberries, raspberries, they tend to have the least amount of effect on blood sugar spikes and falls. And they contain lots of antioxidants, polyphenols, which are good for the gut and gut microbiome. And then we have nuts and seeds, as long as you can tolerate them well. They have plenty of good fibers, plenty of essential fatty acids and oils that are good for our body. And so eating the right types of foods, keeping the healthy gut microbes happy because they do a lot of good stuff for us. Getting nice, clean, fresh water, avoiding toxins, getting physical activity. I think there's some research behind people that are sedentary versus people that are getting an appropriate amount of physical activity in terms of gut health. And here again, it's what helps one thing is going to help all the things.
Mm-hmm. Yep. No, that's absolutely true. You know, I tell people, like, foundations of health are the foundations. It doesn't matter if you have cardiovascular disease, if you want a better gut, if you want a better brain, like, you know, everything interacts. And the worst thing we've done in medicine is it's really dissecting the body into little pieces and ignoring the fact that everything is interacting. Let's go a little bit into some targeted interventions that you may implement. Now, this is one of those questions that I personally hate being asked, but I'm asking you, right? Because I'm a nuanced person. I'm like, well, why? But like, what do we know? You know, because what we don't want you doing if you're listening to this is to take what's going to be said here in this next part and be like, oh, that automatically is going to apply to everyone. And that's why a lot of people are chronically sick is they go to Google, they talk to a friend who had an issue. It's like, yeah, but your friend is not you. Like, you know, even if you have the exact same symptoms, the mechanism behind that's going to be different. So kind of walk us through. I'm more of a thought process person. So kind of a thought process that you would do with someone, right? They've come in, look, my diet's immaculate. I'm exercising. I'm sleeping. I'm not overweight. I don't drink alcohol. I don't smoke. Like, what's kind of the thought process to help an individual who's coming in with what we've talked about? You know, the fatigue, the brain fog, maybe they've got some joint pain and some bloating.
Yeah. So from a gut perspective, so let's assume that we have some testing and there's some stuff going on with their guts, and maybe they have even some symptoms of gut issues going on in addition to some of these other health issues that we often see in our patients. So with the gut alone, we'll stick with that to keep it easy, because sometimes we'll start them with the obviously healthy diet and dialing that in. And we've done some lab work. So if their vitamin D is rock bottom, we want to help them boost that through getting out in the sun more and using supplementation. We might see some B vitamin deficiencies or low magnesium. So usually the first month or so, we want to get them some basic nutrition and build that part of the foundation. And then usually by the month one or into month two, that's when they'll have time to get the gut testing done, and we'll get those results back. So then we start to get to work on that. And the thought process there is, what does their overall gut health look like? Are they super inflamed? Like, is their calprotectin high? Is their secretory IgA maybe really low? So their immune defense system in their guts on the low side. So they don't have a fighting chance of getting rid of the stuff on their own. Perhaps they do have high zonulin, where the leaky gut's a problem. And then their microbiome, their healthy microbes are all on the low side. So in that person, and maybe they have parasites, maybe they have a yeast overgrowth, maybe they have a couple different, and it's usually more than one type of bacteria that's high overgrowth. Maybe the initial me when I first started learning functional medicine was like, oh, there's bad stuff there. There's bad bacteria. There's parasites. We need to kill them. Let's give them antimicrobials or antibiotics if you're a prescriber. But I learned the hard way is you give a person in that situation that I described an antimicrobial. And now what happens is, so one, you might get a quick die off because of those bacteria are being weakened by that, whether it's berberine or oregano or anything like that, but they have leaky gut, right? So all that junk that's being released from these bacteria dying are now going in the bloodstream. So I'm thinking of one person specifically, gave them all that stuff and to kill off the bad stuff, and they're basically in bed with like flu-like symptoms for 3 days. And so not good. And ultimately won't be as effective because, yeah, we can kill them off, we can knock them down, but if they bounce back at all, either they stop taking the antimicrobials, or you have a certain segment of that bacterial population that's resistant to that particular formulation. Now they bounce back, and then the person gets a recurrence of problems. So no, in the beginning, you need to spend a month or sometimes even 2 or 3 building up their system. So helping their immune system, their gut, working on stress, providing things like there's different formulas out there, but whether it's medicinal mushrooms or zinc or vitamin A or vitamin D, using healthy or probiotics or good gut microbes that help support the immune system and calm down the inflammation in the guts. We might even use some prebiotic fibers to help build that up, some amino acids that can feed the layers of the gut that help seal that leaky gut. So you need to do that first, and then we'll come in on the other side, and now we can start going to war with these bacteria and killing them off. And we'll go through a couple different, sometimes we'll alternate like 2 weeks. Sometimes we'll do 4 weeks of antimicrobials. And then on the other side of things, well, now we just waged war. We killed everything off. We got these, the battlefields kind of tore up and smoking and a mess. Well, now we need to rebuild. Otherwise, there's bad stuff's going to move back in again. And it could be the same stuff, could be other stuff. But then the third step of all that. So first step is build up and support. Step 2 is go to war against these bad microbes that shouldn't be there. And then phase 3 is kind of the rebuilding phase so that it's less likely to come back later on. So that's like kind of my overall approach to gut issues. And like you said in the beginning, if for one person it might help one person might hurt the other. So if we're using things like prebiotic fibers, good fiber, that's good for most people. But if you have an overgrowth of bacteria, you're just going to feed those even more and make the symptoms a whole lot worse. So it really needs to be tailored to that person.
Yep. And that's where, using testing is so important, because it's what I tell people when they're like, oh, what's the testing going to do? I'm like, honestly, it helps me be a ninja. It helps me be a sniper versus just saying, hey, your gut's off. And it's like, now you're just being more generic, and it really is, though. It's having that balance of what are things going to be the biggest leverage points versus not. And I think we've all had people that have had that Herxheimer, the die-off reaction. And that's where, like, if you're fragile and you've got a ton of symptoms, it's usually always a horrible idea to kill stuff first. It usually just goes horribly wrong. And just like I spend a lot of time controlling the immune response, so that way when we finally stir the pot, right, we step on that ant pile, we're ready for what's going to happen. Because once again, it does impact people, and depending on how severe a patient is, days or even a week or so that it can really knock them down. Whereas others, if they're in a good spot, hey, they can do it just from the beginning. And that's where it's working with someone is so important.
And that's especially true with C. diff. I'll just highlight that particular organism because, and we see this a lot in conventional medicine. Well, you get treated with an antibiotic, next thing you know, the person has a major C. diff infection. And in a lot of cases, I think personally that C. diff is probably there, just kind of living under the surface. And then when you try to hit it with an antibiotic that's not specific for that, it gets a little ticked off and starts to send out endotoxins in its defense. And we can have this happen with functional medicine as well. So oftentimes we will see C. diff that's in there, and usually C. diff infections are pretty serious. I mean, they kill people in nursing homes due to dehydration and not being able to treat it. So we associate it with like, oh, you're going to have major diarrhea. But we do see it in there just living underneath the radar. And if we just, like, let's say we didn't do testing and we just started throwing random antimicrobial blends at the person, and they do have a C. diff infection or a C. diff population living in there, now they start to release their endotoxins, it can make the person quite sick. Whereas if we know it's there, then we can start with a little bit of Saccharomyces boulardii or something like that. It's a little more gentle, that won't evoke that same response, and then save that person from having that major side effect, that reaction.
Yep. All right. Anything else you would like to share with the listeners?
I think we covered a little bit of everything today. So yeah, no, I love the gut and I love working with people, and we could probably talk about this all day long.
Yep. Yeah, this has been great. If people want to learn more about you, where should they go?
So follow me on social media. It's easy. I like to say I'm the only buddy Touchinsky that I know, and I think is probably exists out there in the world. So if you find me on the social media, that's probably me. But for our clinic, so we see people in Pennsylvania, Florida, and Mississippi. And you can go to gopeakmed.com. And on there, you'll find our website. You can find more information about us. We have a group practice here. And then on that specific page, gopeakmed.com, you can schedule a free discovery call. We can talk about what you have going on, and we can figure out if it's a good fit for what we do here in the practice, whether it's gut issues. We do a lot of work with people with mycotoxin illness, chronic fatigue syndrome, long COVID. So kind of that your doctors can't figure out what's going on. You've been to every specialist and they all say, you look great. Testing's fine. No problems. We work with a lot of people who find themselves in that situation, and we get to the root of the problem by doing things like the microbiome gut function test, advanced labs, et cetera.
Okay. All right. Well, thanks for being on the show. It was great having you.
Thanks a lot. And like always, pleasure talking to you, and especially all these sorts of topics. So thanks for having me.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have, and should seek the assistance of their healthcare professionals for any such conditions.